SHTF, and tuberculosis, the airborne killer. No one sees coming. What if I told you the next great collapse won't start with a blast, but with a cough? A dry cough in a crowded shelter. A breath taken from the wrong stranger on a bus. The kind of moment that no one remembers until it's too late. Tuberculosis.
Mona Lisa, this looks like tuberculosis. Get me a mask and a non-rebreather now.
Got it, Rocco. Temps 103. He's coughing up blood.
Isolation room 1 immediately.
Luigi, this patient's classic for active tuberculosis. Heavy sputum, low O2. Seal it up tight.
Copy that, Rocco. Negative pressure engaged. Cultures are already running.
Alert infection control. Nobody enters without full respirators.
This is...
For most people, that word sounds ancient. Something beaten, something we vaccinated out of existence. But that's the biggest lie modern comfort ever told us. This infection never left. They just waited for us to get complacent. I'm suburban prepper, a combat medic veteran, and a family nurse practitioner trained in integrative medicine. And tonight, we're talking about the airborne killer, hiding in plain sight. You can't see it. You can't smell it. But when systems fall apart, it spreads faster than fear. By the end of this video, you're going to understand exactly how tuberculosis becomes a perfect storm during collapse, how one infection can cripple entire camps, what early signs to watch for, and how smart preppers prepare now before the supply chains, the hospitals, and the air itself start to break down. When society functions, TB stays mostly contained. Hospitals catch it, labs track it, pharmacies keep the drugs in stock. But in a grid-down world, no diagnostics, no transport, no public health network, the bacteria reverts to its old identity, a silent plague that moves through families, camps, and shelters like smoke through cracks. The numbers today look small, about 10 million cases worldwide each year. But that's with laboratories, refrigeration, and supply chains humming. Knock those supports out, and you go back to the world of the 1800s when 1 in every 7 humans on Earth carried it. That's the real threat. TB spreads through droplets. One cough can float in still air for hours. You don't have to kiss someone. You just have to share the same breath. In a blackout winter, when people huddle indoors, in community centers turned into warming stations, one undiagnosed carrier becomes a dozen, 100, 1,000. Early on, it feels like a cold, fatigue, a little fever, weight loss. By the time the cough deepens and the night sweats start, it's already taken root in the lungs. Untreated, it eats away at tissue, slowly suffocating its host over months. No Hollywood jump scare. Just the quiet horror of breath running out. We used to treat it easily, but resistance changed the game. Multi-drug resistant strains are now appearing on every continent. Standard therapy requires a combination of antibiotics, several working together for many months. Miss doses, stop early, or substitute weak black market versions, and you don't cure it. You evolve it. Each incomplete treatment breeds a harder strain. In a collapse scenario, that cycle accelerates. People hoard antibiotics like candy without realizing TB laughs at single drug shortcuts. It takes discipline, coordination, and months of steady supply. 3 things that vanish fast in chaos. Now imagine hospitals short on electricity, labs offline, refrigerators failing, nurses leaving because fuel's gone. What happens to the patient halfway through therapy when the last shipment doesn't arrive? They feel better for a while, walk home, and start coughing again. Only this time, the cough carries a strain no remaining pill can touch. That's how pandemics are born, after the cameras stop rolling. But let's step back. Why should you, a prepper, care right now, before the headlines? Because prevention's the only battlefield where civilians can still win. Ventilation, distance, masks when the air feels stale. UV exposure, sunshine, nutrition, all boring words until they're the difference between infection and survival. Your lungs are the first line of defense. Feed them oxygen, not smoke. If you live rural, open your windows when you can. If you live urban, purify the air when you can. From the integrative side, immune support isn't about magic herbs. It's about strengthening the body's resilience before exposure. Vitamin D from sunlight or food when available. Adequate protein so healing tissue can rebuild. Zinc, selenium, and balanced hydration so your immune response doesn't burn out. And yes, some botanicals show supportive potential. Garlic, licorice root, and astragalus among them. But they support. They don't replace real medicine. Use them as part of a layered defense, not a substitute.
Ladies and gentlemen, Flight 214 to Chicago is delayed. Medical screening in progress.
What's going on?
They said tuberculosis.
Someone was coughing bad on the plane.
Breaking now, confirmed cases of drug-resistant tuberculosis in 3 states.
Keep rolling. Update graphics now.
Health officials urge masking and isolation until further notice.
Psychologically, the biggest enemy in a TB outbreak is denial. People hide symptoms to avoid quarantine. Families keep coughing members home to avoid stigma. That secrecy feeds the fire. You need honesty inside your group. If someone's sick, isolate early, not late. Set up a ventilation zone, assign a caregiver with proper protection, and accept that sometimes compassion looks like distance.
Isolation. Code red. Home isolation.
Rocco, we're out of vents. Every bed's taken.
Then start the waiting area triage. We treat them where they fall.
It's spreading through staff now.
3 more ambulances lined up already, Rocco.
Yeah. And soon there'll be thousands more.
Do you think we can stop it?
Not this one. It's already out there.
Under modern care, treatment lasts many months, longer for resistant cases. That's half a year of consistency most preppers can't guarantee. So preparedness isn't about hoarding pills. It's about understanding environment, containment, and long-term health planning. You don't beat TB with a bottle, you beat it with endurance. Historically, sanatoriums saved lives because they gave patients what cities couldn't: rest, nutrition, and fresh air. If the grid collapses, the sanatorium model comes back. Not luxury resorts, but isolation shelters outside main camps, with open air and strict routines. Build that into your community blueprint now, not after someone coughs blood. And remember, TB isn't just a lung disease. It can seed in bones, kidneys, even the brain. It can mimic other illnesses until it's too advanced to fight. In a collapse, you won't have CT scanners to tell you where it hides. You'll rely on observation, persistent cough, weight loss, night sweats, low-grade fever. Patterns save lives when machines can't. Every generation thinks its threats are new. Ours are just recycled. History's deadliest pathogens never disappeared. They just got quieter while we looked at our phones.
It's over, Rocco. There's nothing more we could have done.
We never had a chance.
Not with how fast this thing's moving.
When comfort collapses, the old ghosts wake up. Tuberculosis is one of them. You can't shoot it. You can't run from it. The only weapon is preparation, clean air, strong bodies, knowledge, and discipline. If your community understands how TB spreads before the headlines break, you've already won half the war. This isn't paranoia. It's history repeating. We think of plagues as medieval, but recent years proved how fast the modern world cracks. TB will exploit that crack when it comes again. So tonight, add one more line to your checklist. Lungs. Protect them like you protect your ammo, your water, your family. Because when the coughing starts echoing through the shelters, it'll be too late to ask what that sound means.
Restaurants authorities confirm new tuberculosis clusters in 5 more states.
You can lock the doors. But it's already everywhere.
This is survival. This is resilience. This is suburban prepper. If you're ready, I'll move straight.